Order. On behalf of honourable members, I would like to extend a warm welcome to the Honourable Tan Sri Azhar Azizan Harun, Speaker of the House of Representatives, Parliament of Malaysia, and his delegation, who are present in our gallery. Questions for oral answer? Mr. Seah Kian Peng.
Question one, please.
Madam Deputy Speaker, may I have your permission to have question one taken as part of the ministerial statement to be delivered by the Minister for Culture, Community and Youth, Mr. Edwin Tong, at a sitting in August 2022, as he is still COVID positive this afternoon.
Okay.
Thank you.
Go ahead. Mr. Ong Ye Kung.
Madam Deputy Speaker, with your permission, may I address the PQs for oral answer number 2 and 3 in the order paper. And in my reply, I will also cover written PQs number 43 and 21, filed by Ms. He Ting Ru and Mr. Ip Hong Wing on the topic of COVID-19, filed for 4th and 5th July, respectively, please.
Please go ahead.
Thank you. Mr. Ong Ye Kung asked how we will reduce infection rates of the Omicron subvariant transmission. We anticipated this wave when we learned about the subvariants BA.4 and BA.5, which has a significant growth advantage over BA.2. This wave, however, arrived slightly earlier than the July-August timeframe that we anticipated. We have therefore maintained, that is why we have maintained the indoor masking requirement even when cases were low and stable, in order to moderate the infection rate when this new wave arrives. High vaccination coverage that we have will also tempt the size of the wave. To reduce infection rate further, all of us can play our part, stay at home when we do not feel well, test ourselves regularly, especially if we are meeting people who are vulnerable or we attend big meetings or events, such as before coming to Parliament. And if we still want to reduce the infection rate even further, more stringent safe management measures, or SMMs, will need to be implemented. And that means reintroducing things like group sizes, capacity limits, masking outdoors. You know, we, as Minister for Health, I can never say we will rule out these steps. We cannot rule out these steps if we are hit with a serious infection rate. But as far as possible, we should avoid them, especially if we are reasonably confident that our hospital capacity can hold up and that we are determined to live with COVID-19 and continue our journey of endemicity. For this current wave, our assessment is that it will not be as severe as the Omicron wave we experienced earlier this year. This is because many more of us have gained stronger immunity either through booster shots or recovery from infections. And this will significantly impede the circulation and transmission of the BA.4, BA.5 viruses. In South Africa, the second Omicron wave, driven by these two subvariants, was approximately a third of the peak of the previous Omicron wave. But every country's experience will be different and unique. But we have good reason to believe that this will be a smaller wave than the last. Today's Tuesday. Tuesday is always the day where cases spike up. We should expect at the end of today case numbers of over 12,000. This is a tad higher than the same time last week, which was 11 over 1,000. So 10% more than last week. So there are indications that we are near the peak, if not at the peak, and we should be relieved that the number this week did not double from last week. Otherwise, we'll be at 24,000 or 22,000 this week. The key is to ensure that hospital capacity is not overly stressed. And here we have been relying on two strategies I will go through today. First, ensure high vaccination and booster coverage so that as many people as possible are protected from severe illnesses if they are infected. Second, ensure that our healthcare institutions and facilities are prepared and be able to ramp up should there be increased admissions. And these strategies continue to be relevant for this current wave. Let me talk about the first point. In response to Mr. Ang Wei Neng's and Mr. Yip Hong Weng's questions, the most important is for everyone who is eligible to take their first booster shot, or this is their third shot. First booster is the third shot. After several mutations, we now need 3 shots of vaccines to properly protect ourselves against the Omicron variant. The vaccines were developed in the early days, the wild type, or alpha and beta, when you need only 2 shots. With more mutations, we now need 3 shots. There are about 60,000 seniors aged 60 and above who have not taken their first booster or third shot. This number has come down from last week when DPM Wong and I announced that there were 70,000. It has now come down to 60,000. So they are coming forward, which is a good thing. But we urge all our seniors who have not taken your booster shot, the third shot, to do so quickly, because it makes a huge difference as to whether you will fall severely sick if infected. We have also recommended since March that vulnerable individuals should take a second booster or your 4th shot. This includes all persons aged 80 and above, those living in aged care facilities, or those with underlying illnesses and are vulnerable. In recent months, we have stepped up our efforts to remind seniors to do so. We made regular announcements and have been progressively sending out SMS notifications, reminders to eligible individuals. And they can walk into any joint testing and vaccination center or participating public health preparedness clinics, or the PHPCs, or polyclinics to receive their second booster dose. Alternately, individuals, you can also book an appointment using your notification SMS. Since 27 June this year, we have also been sending out our mobile vaccination teams to our heartlands to make it even more convenient for our seniors to get vaccinated and boosted. We will cover a total of 60 sites. Last week, we planned for 50. We're going to increase it. Now we will cover 60 sites. Staff and volunteers from our partners, People's Association, the Silver Generation Office, they are also reaching out to our seniors through house visits, through engagement dialogues, and to address many of the queries that the seniors may have. Many members of this House, I also know that you've been reaching out and talking to seniors and engaging them, and thank you very much for doing so. Persons who are recommended to receive the second booster under prevailing recommendations should proceed to do so, even if you have contracted COVID-19 previously. Ideally, an individual should wait 90 days after infection to take your second booster. It will help the booster shot work better. So wait 90 days and take your booster. But if you are in a hurry for whatever reasons, we will offer the second booster at least 28 days after your infection. So please tell your residents, if you have been infected, doesn't mean you are exempted from the booster. All of us respond differently. Some of us hardly have any response. So to be safe, take your booster shot. The second prong of our strategy is to augment and optimize our healthcare capacity. While current international and local evidence show that severity of the Omicron subvariants are not worse compared to that of the earlier Omicron strains, our hospital, GPs, and other healthcare institutions are on standby to bolster their capacity to prepare for future waves. Our hospitals remain ready to ramp up dedicated ICU and isolation bed capacity should there be an increase in the number of COVID-19 patients who require hospitalization. Actually, there are, and they are already doing so, and they are now very busy. We have also maintained sufficient beds in our COVID-19 treatment facilities, or CTFs, to manage serious cases but do not need hospital care. We have recently consolidated our CTFs from about 2,000 over beds to 1,300 beds, but with higher manning ratio. And this will make it easier to transfer patients from acute hospitals to the CTFs without a significant drop in level of care. And they are now about 25% occupied. Our GPs continue to take care of COVID-19 cases within the community, and nursing homes are equipped to manage lower risk cases within their facilities. To help reduce risk of developing severe disease and hospitalization, COVID-19 therapeutics, such as the oral antivirals like Paxlovid, are made more readily available in primary care and nursing home settings as early treatment. And pre-exposure prophylaxis is available in hospital outpatient settings for at-risk populations. As at 30th June, all polyclinics and 103 participating PHPCs can prescribe oral antivirals to clinically eligible patients in the community. With these measures, the vast majority of cases are managed outside of hospitals, which is appropriate given the high level of vaccination in our population. However, our public hospitals continue to face high demand from non-COVID-19 patients, what we call business as usual patients, the BAU patients. Over time, we hope more of our CTFs can be multi-purpose isolation and treatment facilities for both COVID-19 and non-COVID-19 patients. We have already reconfigured one of our CTFs at Sengkang Community Hospital into this new model, and we will explore converting other CTFs. Finally, Ms. Herting-Rue asked about healthcare subsidies related to COVID-19 pandemic. As at end FY 2021, the government has spent about $730 million and $220 million on subsidizing inpatient and outpatient treatments for COVID-19 respectively. And since February 2020, we have progressively stood up more than 1,000 PHPCs. Alongside our polyclinics, the PHPCs play critical roles in providing government-subsidized swabs, COVID-19 vaccinations, and oral antivirals. We did not reduce the number of PHPCs earlier because we anticipated a new wave of infection, which did happen. And we are now in the middle of this new wave, and it will be inappropriate to stand down PHPCs at this juncture. This is in response to Ms. Her's question. So in conclusion, Singapore has been weathering the COVID-19 pandemic through a comprehensive approach. While we have assessed that there is no need to tighten SMMs for now, we urge everyone play our part, take the necessary precautions, exercise individual and social responsibility to keep the infection rates low, support our healthcare workers and healthcare institutions to weather through this wave. Thank you.
Mr. Ong Ye Kung.
Thank you, Deputy Speakers. Thank you also, Minister, for a very comprehensive reply. Can I ask the Ministers, what is the percentage of the recent COVID-19 infections that are caused by the subvariants, the two subvariants, BA.4 and BA.5? And whether MOH is considering sourcing Moderna or Pfizer's updated COVID-19 booster shots that can better target at the variants, at the Omicron variants, the subvariants of it. Thank you.
Thank you. Of all infections, now about 50%. The latest number is 50%. BA.4, BA.5, mostly BA.5. It has been doubling every week. Started 3%, then 5%, then 8%, then 16%, 30% last week. This week, 50%. Next week, I will expect it to be 70, 80%. Yeah. It is clearly a more dominant subvariant compared to BA.2. The Pfizer and Moderna, as a member pointed out, they are indeed developing bivalent vaccine, means it targets two viruses, the original wild type that started in Wuhan, as well as Omicron variant. So early data, this is early data, does show that this bivalent vaccine elicit a stronger immunity response in individuals who have taken them. but it's very early days. We will continue to study the risks and benefits of using such a bivalent vaccine, how to apply it in Singapore. And as of now, our contracts with both pharmaceutical companies do allow us to accept shipment and implement them when ready, probably by end of the year, if they are approved, if the data shows it's all right, and we receive the shipment. But I should add the very important but at the end, do not wait for this bivalent vaccine and hold back taking your booster. We have 60,000 seniors, also those with conditions that are vulnerable. If you have not taken your first booster, you need to take it now. And if you are 80 and above, live in an aged care facility and vulnerable, you do need to take your second booster now. And the current booster, the current formulation, works very well in preventing you from falling very sick. So do not delay taking your booster.
Mr. Yip Honowing.
Thank you, Madam Deputy Speaker. I thank the Minister for his reply. I have two SQs. First, it was previously reported that there was a wave of manpower leaving the public healthcare sector. Have we been able to hire new staff to make the shortfall? Is it enough for the next wave? Second, the hospitalized number of COVID cases have increased over the last 3 weeks. Will there be a cutting back of elective surgeries in our hospitals on the horizon due to COVID situation? Thank you.
Let me answer the second question first. The answer is yes. Number of hospitalization cases have reached almost 700 now, so it has increased quite significantly. This is as compared to the height of the Omicron variant, the Omicron wave earlier this year, where we have about 1,700 hospitalization cases. Now it's close to 700. And at that time, we cut back BAU by 15%. So we have now started to trigger some cutback of BAU, mostly electives, and the cutback is about 4%. And so about 700 beds, 4% cutback in BAU, compared to the height of Omicron variant, 1,700 beds, 15% cut. But as I mentioned earlier, from today's number, we have reason to believe the wave should be near its peak, and I hope from here, things hopefully will be better. Manpower indeed is a challenge. The current attrition rate is comparable to what we experienced in 2019. February, there was a slight spike after bonuses has been received, but otherwise, in the latest number, month on month, is comparable to what we experienced 2019 pre-COVID. Having said that, it is increasingly difficult to hold on and to recruit foreign nurses because with COVID-19 being a global pandemic, hiring of nurses is a matter of international competition. Yeah. The good thing is locally, I think young people's perception on the nursing career is by and large a positive one. I am very thankful. Actually, MOH and healthcare, we have our fair share of talent. And when Nanyang Poly or Ngee Poly or SIT open up their courses, it's always oversubscribed, lots of competition. People can't get in and they actually come to us to appeal to get into nursing courses. Mid-career conversions also have a healthy pipeline, but our cohort size is limited. Our healthcare demand is growing. So therefore, we must be able to accept that over time we have to recruit more foreign nurses from different sources, be able to take them in, train them, and over time be able to, recognizing that this is international competition, be able to review pay them competitively, and the good ones over time should be able to be part of our community, become PRs, and live with their family here, go to local schools here. I think this is the only way for us to not just weather through this wave, but as our population get older, that profile of our, or that size of our healthcare workforce will have to increase. And we have to tap on both a strong local pipeline as well as foreign recruitment.